I haven't done a video consultation for blepharoplasty for many years, so I wanted to update you now. I'm shooting this in late 2025 of how I do blepharoplasty today. Things may change in a year or 2 years because I'm constantly evolving my technique, but the foundation is still there. So blepharoplasty for me, in Greek, blepharo, eyelids, plasty to change the shape of, involves more than just traditional cutting of skin or pulling on something else. And it involves a more comprehensive understanding of the eyelid area. However, when I use the word upper blepharoplasty or lower blepharoplasty, I will be specifically talking about fat bag removal for the lower lids and skin removal for the upper lids. That is a fundamental way to achieve the results, but to me, it doesn't provide global rejuvenation. It requires more comprehensive therapies to get the most attractive, youthful results. So what I'm going to talk about is really how to understand the upper eyelid and then the lower eyelid separately so that we can talk about it. The biggest thing to understand is that a lot of times when you walk into my door, a lot of women in particular are very focused on symmetry. The left and right side looking identical, or making sure that there is absolutely, a little crease near their eyelid is gone. And this is not what the goals of surgical treatments would be focused on. My goal is, of course, natural and safe and attractive, but I want to focus on how to achieve these goals more specifically. So for the upper eyelids, the traditional methods of doing upper eyelids would be brow lifting and blepharoplasty or excision. To me, I don't do a lot of brow lifts. I do one probably once or twice a year, but I do a lot of blepharoplasty with other therapies, other types of surgical treatments, and I want to explain to you why. So a blepharoplasty is skin removal. Sometimes people take fat and muscle as well. I think fundamentally, blepharoplasty is the bonus, not the core. Unless there's just a lot of extra crepey skin, then yes, it can be the core and it can be done as an office-based treatment where I don't even sedate you. I just put some numbing cream and take out some skin, and absolutely that's possible. But to me, the real problem with the upper blepharoplasty is that it changes someone's appearance and it doesn't solve the problem because it just takes too much skin away. And I really don't take fat or muscle away, with one exception. Sometimes there's a little fat bag that sticks out from the inner portion. So literally 1 in maybe 20 patients take out that little fat pooch that doesn't look right. But in general, I think it's too excisional, where you just take too much skin away and then you lift the brows up and it doesn't make the eye look younger. It actually hollows the eye out. So for me, an integral component to the upper eyelid, for those that understand this, and I think it's important to show photographs and explain it, is that it needs volume. So think of it like a balloon that deflates. When a balloon deflates, it starts to become empty, and you think, oh, I just need to cut it all away. But when you reinflate a balloon, it actually looks much more youthful. And so that's how I look at fat. Now, for people that really don't understand this context and they go, that sounds great, but it's really not what I had, go back and look at your photos 10 years ago, 5 years ago, 20 years ago, even if it's extreme youth. If you say, look, Dr. Lamb, I don't even like how fat my face was at 18 or 20, you absolutely do not get me. I will tell you, if you go back in time, even to extreme youth, and even if you said, Dr. Lamb, that's not what I want, that volume, you will see your brows were much fatter. And so the line that I want to teach you to see, if you look at my eyes, is not the saggy skin, but the hollowness. I'm 56 and you can see the bone line all the way around my eyes. This line up here where my fingernail goes is the bone emptiness that occurs with aging. And that's where I put fat. And it's not a plump brow, it's just enough fat to soften the bony edge. And to me, that is an integral component because traditional blepharoplasty is too excisional. Take it away, cut it out, lift it up, and then you have this open eye, very hollow crease because you've taken fat, muscle, skin away, and it looks nothing like you used to do. All you've got to do is look at your old photo and go, Dr. Lamb is right. And I've never met you, of course, because I'm talking to the general audience on YouTube, and I can tell you that I already know what you look like better than you do of when you were younger. And all you got to do is look at that. You're going to see that maybe in youth, you still had that line, but it was less obvious. It was more cushioned with fat. And so fat grafting to me is an important component to the equation. So the last part that to me has become really, really important in the last couple of years is ptosis repair. So ptosis repair is spelled with a silent P, P-T-O-S-I-S. Ptosis repair involves improving the eyelid opening. And so when we get older, if you look at me actually, my eyes are narrower. It's not just because I'm Asian, but my eyes don't open as much in my mid-50s. So ptosis is not skin removal. It's not adding fat. It's not a brow lift. It is an internal repair from inside the eyelid to shorten a muscle called Mueller's muscle to allow the eye to become more open. And I used to perform both external levator advancements as well as internal Mueller treatments, but I love the internal because I find it to be more consistent and I don't have much recovery, and you can be under any level of anesthesia to do it. So I perform both, but I really prefer the internal now, almost uniformly. And so when you come in for consultation, if you said, I don't know if I have ptosis, I don't even understand what you're talking about, I give you some drops called the phenylephrine drops, and these drops help me show you what a ptosis repair looks like. And I'll take a photograph of your eyes before and after, and you really get it. And also I can sell you these prescription drops called Upneek that are an alternative to a ptosis repair for those who absolutely just don't want it. Or if you said, look, I don't want ptosis repair, then don't do it. I always say what's on my menu. I'm going to show you sea bass, filet mignon, and Brussels sprouts. If you said I'm a vegetarian, okay, I'll give you Brussels sprouts. So I'm not forcing you into a fat graft. I'm not forcing you into ptosis. But if you don't understand fundamentally, I think blepharoplasty is truly an error of how we address the eyelids, of just excise it, cut it, pull it, stretch it, then I don't think you can really understand what I offer is uniquely different. And so ptosis repair, there's no stitches. It's done from inside the eyelid. And these stitches dissolve within 5 days. And I'm shortening what's called Mueller muscle. So the eye is just open by maybe 1 to 3 millimeters more open. To me, it's very important. The youngest person I've done it is a 29-year-old. He was just born with a very small, with ptosis. It wasn't aging. And I've also done it in 80-year-olds. So it's that gap of 20s to 80s just shows you the width of time that ptosis can be affected, either congenitally, in other words, born with it, or just as we get older. And every year of my life, my eyes get a little bit narrower, but very marginally so. And so this ptosis repair can correct decades of issues. I cannot get exact symmetry. I cannot necessarily get everything corrected, but it's a contributory factor that to me is way overlooked and not practiced by most blepharoplasty surgeons because it requires a specialized skill to do this. And to me though, it's a fundamental element to how I look at aging of the upper eyelid. And it doesn't really add much recovery, swelling, pain, or bruising, but it really helps just make that eyelid look a little bit more youthful. If you look at your old eyelids, again, for me, I don't need to look at your old photographs. You're welcome to bring them in so I can show them to you. But if you look at them, you're going to say, wow, Dr. Lamb is right. My eyes were more open. I can take all the skin in the world away. It won't fix the issue. My eye is progressively getting slightly narrower. And I see this in the 30s. I see this in the 40s. I see this in the 80s. So, and I've got every decade of life that I can show you for before and afters that it works on. So that's ptosis repair. For an upper blepharoplasty, as I hinted at, if you just want that, and that's why you came in, I can do that in the office. Very simple. And what I do is I take a little bit of skin away, and then I just basically I put a little stitch in. I take that stitch out at a week. The good news is that the blepharoplasty also has very little recovery time. I'm only just taking a little bit of skin away, and sometimes, as I said, a little bit of fat from the inner A-frame is called, and then the stitches come out. I used to use dissolvable stitches for the external skin. I don't like that because I've had a little bit of, I could see a little bit of a bump, and I was able to fix that just by putting a small cautery, but I stopped doing that because I don't want to do that. I use very tiny instruments to take out the stitches, so it really has very little pain. We're going to talk about fat grafting survival, which is a natural question because it is an integral component. Once I finish the whole eyelids, I'll separately talk about that. So brow lifts. Do I do brow lifts? I do. And so when do I do a brow lift is a natural question is when I see a lot of lateral canthal descent that someone says, look, I just don't want that incision to go farther. I just want that improved. Oftentimes, just making that incision just past the canthus adding a little bit of fat usually rectifies it. But for those that really have a lot of brow sag on the outside, I do basically a lateral temple elevation. So it's a small incision on the hairline, and then I just lift it. Now, why do I do a skin-only lift? There's a general principle. Now, I can do endoscopic. I used to do endoscopics every week, but I found that they don't really do a lot, and they require a little bit more intense elevations of tissues that don't translate into results. So I do a lateral temporal plasty to elevate the brow in the context I've explained, but I do it because I always say the closer you get to the problem, the better results. So I don't want to release this entire, what's called arcus marginalis, to elevate the entire brow, because I think brows are way overlifted. They're much higher than they were at youth. And a Beverly Hills colleague of mine says brows don't fall as much as we lift them, and I would agree with that. So what I'm talking about is just a small incision along the hairline that I use a dissolvable stitch for, and a deep one, and then I use a small one on the outside that's both dissolvable and removable, and I just elevate the very lateral brow corner. That's the only brow lift that I will perform, because I do not believe elevating the center makes any sense. It just creates a surprised appearance, and it does not look like how you used to look like. So you said, well, how about wrinkles? I hear people release brows, with the wrinkles, and I don't believe in that. I think that there is a lot of contour irregularity problems. Sometimes you nail it, sometimes it can be problems, and it can be nerve issues. I don't treat wrinkles with surgery. That's going to be Botox. And if you say, well, Botox doesn't last, absolutely. And the quality I do, once I do it a few rounds, you can oftentimes go 1 to 3 years, and you just don't need very much of it. So if you're talking about wrinkles, skin treatments, that's a different lecture, that's a different virtual consultation that I don't want to go into. I'm talking about just sort of surgical problems of the eyes and what I can do to improve that situation. So that's the context of blepharoplasty. I probably do blepharoplasty in 1 in 50 patients. I do a Ptosis repair in probably 1 out of 2, and I do fat grafting on almost every single patient unless they don't want it. So I would tell you that these are the concepts of the upper eyelid that probably don't make a lot of sense to you, especially if you've done another consult elsewhere, because everyone else wants to just cut away skin, take out all the fat and muscle, and lift the brows up. That makes sense to you, because I do this, you go, I get it, I want that. But if you go back and look at your old photographs, you'll really see that's not the issue. So just like the upper eyelids, the lower eyelids have 3 or 4 problems, and I sort of want to walk you through how I visualize the lower lids and why. So for the lower eyelids, there is hollowness, which is going to be fat grafting. There's going to be an eye bag, which is an eye bag removal, and then there's going to be some crepey skin. Not talking about necessarily wrinkles, because that needs really some Botox treatments for that. But I want to talk to you about how I manage each component. So let's talk about the eye bag removal. So I do what's called a transconjunctival blepharoplasty. So the reason I do this is that it's not to save an incision, but when you make an external incision, you have to reconstitute the strength of the lower lids, and you can cause eyelid shape changes, you can cause functional problems, eye closure problems. And fortunately, in 23 years of practice, I've never seen that, not even once. And I do very safe blepharoplasty. When you go through the lower eyelids, I don't even need a stitch. And it doesn't even almost add any recovery or bruising or swelling, because by going inside the eyelid, you protect what's called the lower lid retractors, so you don't get that issue of problems of eyes not closing, etc. Again, I've never had that issue from this problem, or eyes being pulled down, etc. Now, if your eyes are rounded, either from prior blepharoplasty, that's a different surgical correction. We're not talking about revision eyelid surgery, and again, I've never created that in 23 years. I'm not talking about, sometimes you see these people with incredible sun damage, they have a little bit of lateral canthal showing where you can see that conjunctival, that pink showing. That's a lateral tarsal strip procedure to shorten that. This is not part of this standard blepharoplasty. I'm just talking about, hey, I have some aging in my eyelids, what can I do? So that's going to be a fat removal, and then fat grafting are my 2 principal elements of treating this. The one thing I want you to know is, if you look at me, I've got a little bit of a malar ligament due to fat loss here. Some of that could be corrected if it's just volume loss by adding volume around the lower lids. I don't put fat in the cheeks. I think people look crazy, and it can be softened. But what I do, if there is just a small linear deficit in called a malar bag, I'll put little drops of fillers to soften the crease. Doesn't migrate, doesn't have a problem. That's a whole different topic again. Or I've actually cut the thing out if it's a really big bag that, I hate to say, it looks like a testicle. This is a separate discussion. I'm giving these small reference points to things that are related but not part of the core subject. But I want to mention those because I don't want you to think you bought A and you got B or vice versa. So the fat grafting around the eyelids has a lot of bad rap. Some of the bad rap of it is that it doesn't survive or it's lumpy. And fat really, really does survive. I've been doing it for a quarter century. It absolutely works. I've written the most popular textbook in the world on this in 2006. Why am I talking about fat grafting when you signed up to hear a video on blepharoplasty? Because to me, volume loss around the eyes is a core product of aging. And what we do as surgeons is take too much of it away. And when we don't add some volume back, we just hollow the lids out and it doesn't look youthful. So that is why, to me, a fat graft of the lower lids is very, very, very important. And I don't get lumpiness around the eyes. I've had maybe a couple cases of that in over 23 years. I've had to fix that, but it's been easy to correct. A small incision, I get it out, but I will tell you, I do this about twice a week, and it's so rare that I ever see that. And oftentimes, if there's a little bit of lumpiness, it goes away by itself. So it's all technique driven. I've lectured across the world of how to put fat grafting around the eyes very, very safely, and it lasts. So let's talk about, I know this is more in the category of fat grafting as a general discussion, but I do want to discuss with you how fat grafting survives. I promised you that component of the discussion. So fat grafting, I call it the 3 phases of fat grafting. So the first 1 or 2 weeks, it looks puffy and it doesn't look great. It's a little swollen. You're welcome to look at my videos and photos on my website, lambfacialplastics.com. And then subsequent to that, it looks too perfect. So somewhere between 1 to 2 months, you may think this is the best thing you've ever chosen in your life. And then somewhere at about a year, you may think, or 6 months to a year, it wasn't as good as it was early on. The reason why that is that the fat, first of all, there's a little swelling that looks too good. And if you had an original blepharoplasty somewhere else and it looked good for a while, then it didn't look so good. That's what a fat graft looks like when it's slightly swollen. So when the fat settles, you're gonna, if you're at 6 months and wonder, hey, it's not as good as I thought it was, come in and take a photograph. And I had a lady from Baltimore came in actually just upset at me thinking her fat didn't survive, took a photograph. Wow, I look good. Had a lady just 2 weeks ago, 5 months out, say, I don't know if the fat is even stuck. And I looked at her, I said, man, you look great. Took the photo, she goes, wow, I look that good? Yes. Because when you go through this plane of phase 2 between 1 and 2 months, you may think, oh, it looked really, really good at that time, and now it doesn't look so good. It does look good. I'm not going to make it perfect. So my second lesson is what I call right brain results, where you just look a lot better, but I'm not necessarily going to make everything like flawless and gone. And so women in particular, they put makeup on, they get really close to their face, and they go, oh my God, you could have done better here or there. But no, it's gonna look exceptionally better. It's just, you just go through that perfection phase and you may go, well, I still have a little line here. I'm not treating a line, I'm not trying to get rid of it. I'm just trying to make someone look more youthful, natural, like themselves, and more rested. And so those attributes are through these 5 or 6 small procedures rather than one big one, because just excision, cutting it away, pulling it out is not going to solve the problem, in my opinion. Yes, I'm against the grain on this, but I really think that a little bit of add, a little bit of subtraction, a little bit of change here really is what aging is. And again, I encourage you, if you just absolutely don't get what I'm saying, because you're going to go do 5 consults and realize, hey, I'm the voice in the wilderness. Until you go look at your old photos, you go, man, he's spot on. Everything he's telling me is exactly what I had. In fact, I had a lady today, I did a chin implant on her 4 years ago, and I said, you could use a blepharoplasty, but I would add fat. She goes, oh, I just had a blepharoplasty a year ago, but didn't see a difference. Why? Because she didn't add the fat. Because all you do is when you take the bag out, look at me again. I'm a great example. I'm poster child of aging. You can look at the eye bag here, right? No doubt, I can take that eye bag out, but if I take that out, now I've got a hollow rim. So people see the positive space issues. They see the bag, but what they don't see is the hollowness around it. And so if you look at my eyes, you could see saggy skin, you can see saggy brow, you can see an eye bag, but what you need to see is there is a volumetric collapse of my eyes. There's boniness because I'm in my mid to late 50s, turning 57 in about a month. So I want you to think through that and really understand aging, because the positive space problems of eye bags, saggy brows, too much skin on my eyelids are very easy to articulate, very easy for me to convince you that's what you have. It's very hard for me to tell you you need a little fat graft in your brows. No way, Dr. Lamb. Well, okay, look, again, I can't force you to do it, but until you understand why, you will not understand, why I even should do it for you. So that's important. You understand all of those things. So the next question is, final part is I oftentimes will do a little laser unless you are Black or Indian, and that can just tighten up the skin a little bit. If there's a little crepiness, I will do a fractionated CO2 laser, very quick recovery. I've got makeup product called Oxygenetics that really covers that incredibly quickly. But that's something else that I mentioned to you, just so you know that. In terms of the procedure, I prefer general anesthesia. It's done here in my office. I harvest fat. Welcome to watch my fat grafting videos. I harvest fat just with a small cannula in the thighs or bellies. I process it using what's called pure graft, which is allowing me to get the most processed, high quality fat for survival. And that doesn't require injections. Sorry, it doesn't require cutting. So most of all the incisions is just a tiny little bit of skin away, and I don't always do that. And some people that just don't need it. About half my patients don't even need an upper blepharoplasty. It's a mistake to think that. So these are all small little things. So it's done here. I use board certified anesthesiologists have been handpicked with me. The one exception is if you've got a major cardiac history, et cetera, then I have privileges at a hospital that's about 30 seconds from here that I operate in. And that I do maybe once a year or once every other year if someone just doesn't qualify. And we'll go through a medical clearance with you. We're Joint Commission accredited, so you can do everything on site in my surgical facility in Plano, Texas, just north of Dallas if you're flying in. By the way, if you do fly in, if I'm doing this procedure, theoretically, you could even fly out the next day or so. If I'm doing the upper blepharoplasty where I'm actually taking the skin away, I really need you here for the week. And the reason is I want to take out the stitches. I actually personally take the stitches out because it really hurts if someone else is doing it. And I use micro instruments to remove the stitches. So if you have an upper blepharoplasty, really need you here for a week. If I'm doing a face and neck lift, that's another video. I need you here for the week. But if I'm doing just blepharoplasty, theoretically, within a day or 2 or 3 days, you could probably leave and not really have much consequence except looking a little bit of swollen. So let's talk about the recovery, because people want to know about pain. They want to know about swelling, bruising, all of those things. So generally speaking, bruising is usually not that significant, and the reason why is that for patients that have not had heart disease or strokes or not on oral contraceptives or testosterone, I can give an intravenous dose of what's called tranexamic acid or TXA. So my patients have almost no bruising with that. And oftentimes if they have a bruise, they can suck it out. If they have a bruise that shows up, I can actually inject an anti-bruise and suck the bruise out pretty quickly. So most cases, if you follow all my supplement things that you don't want to, not taking supplements, et cetera, for 10 days before, and we'll walk you through that, most of my patients are not significantly bruised. The biggest issue is not the swelling from my ptosis repair, my blepharoplasty, or my lower blepharoplasty. It's just the fat graft. The fat grafting will look distorted. And I usually tell patients take about 7 to 10 days off from work, but you will not look perfect. What I generally say is at 1 week, no one likes it. At 2 weeks, other people will probably think you look fine, but it may take you 3 weeks to like it. There's very little pain. I've invented a technique called Theracross. I'm about 2 years into the patent process. This is going to sound like voodoo, and I apologize if you want to turn this off. If you think I'm too voodoo, you can. But this is something really, really cool to me, and it's insane because I do this for all my patients on day one. So one, if you have any pain on the body from the harvest or the face, I can immediately eliminate with my Theracross. I'm not going to describe too much because I'm in the patent process. If you get nausea, like I had a lady I did a facelift on 2 weeks ago from Colorado. This was her third facelift. Her last one was 9 years ago. She literally got up from the anesthesia, vomited. When I did her treatment, because I knew that, I treated an anti-nausea before she woke up, all natural with my technique of Theracross, didn't have any nausea during her entire recovery. If you have sore throat from general anesthesia, I can immediately eliminate that. So I can eliminate pain, tension. If you have a sinus headache, if you have migraines that show up, I can eliminate almost all of that immediately on day one at no extra charge. So that is a component of this. So if you're worried about being bedridden because you're in pain, no, it's just that the eyes look a little distorted. You see my glasses cover my aging. That's a little dirty secret, but you can wear glasses to cover some of the swelling. That can really help you with blepharoplasty. In terms of skin management, you can look at my videos on mesobotox. You can look at my videos on microdose fillers. You can look at my videos on face and neck lifts, hair transplant. You can look up all these things that are related to the aging process, but really lie beyond the scope of blepharoplasty. So blepharoplasty to me falls far beyond this concept of, hey, let me just cut some skin away. because it really, to me, has a much more fundamental issue of volume, and has an issue of ptosis, and it has an issue of crepey skin, and has an issue of eye bags, and has an issue of volume loss. And when you understand the complexity of aging, and sometimes brow lifting and brow ptosis, if you understand that there's this multifactorial component, yes, I could pick a piece and take out that one piece and just do like an upper blepharoplasty, but to me, it's not going to solve the question as well as doing this. And so this is meant to be what I would tell you during a consultation, and bring in those old photographs so you can really believe that what I'm saying is not contrivance. And I can't tell you everything in my mind because I'm not customizing it to you. And I know this is an incredibly long lecture that's stretching close to 30 minutes, but I want you to hear this so that you can understand more about my philosophy, and then we can refine those elements as you go through my website, as you go through a consultation with me. And I welcome a spouse. If your husband or your wife, please bring him in. There's several reasons why. After I've gone through this whole long complex discussion, or have them watch this video, this long complex discussion, the last thing I want is to go through the whole thing again because they don't even understand this. And they need to have buy-in so that they understand what I'm doing as well, because oftentimes, like, I don't want my spouse to look crazy, or a dangerous surgery. So it's important that they hear it, in my opinion. And again, sometimes just watching this video could be enough. So hopefully this video is helpful. And if you have any questions, let me know. I'd be happy to see you in person and do a consultation with you.